Hi there, so my name is Stuart Armstrong and I'm a sports and exercise physician working in Hamilton, New Zealand. And today I'm talking about cortisone injections. So if you're watching this video, it's probably because someone has recommended that you have a cortisone injection or you're interested to find out more about a cortisone injection. Um, Cortisone is a very strong anti-inflammatory, and this is some cortisone drawn up all ready to go. And the reason that we inject it is to get rid of inflammation. If we can get rid of inflammation, then that decreases the pain. And if you decreases someone's pain, then you're able to do some strengthening exercises, build up the strength, and hopefully get things back to normal. It can also give the body some time to heal the underlying problem and give it a chance to reset and get back to normal. The important thing is that cortisone by itself is just a strong anti-inflammatory. It just gets rid of the pain. It doesn't actually fix the underlying problem. When you inject cortisone, about 95% of it stays where it's injected, so it does have a very local effect. And that can be very beneficial because you don't get the systemic side effects that some medication like long-term anti-inflammatories can give you. You do get some side effects and there are some risks to a cortisone injection. So anytime anyone sticks a needle through the skin, there's a 1 in 10,000 risk of inducing infection, which is not that high and not that common to have. It depends where the injection is as to whether it's something to worry about. Other side effects, 1 in 20 people, 5% of the population will find that it can flare up the pain for a day or two, and that's something called a steroid flare. So if you wake up the day following a cortisone injection and your pain's worse, it's likely to be a steroid flare, and you can take just simple analgesics, paracetamol, ibuprofen to settle that pain down. If you have a severe steroid flare, then I normally tell my patients to either contact myself or contact their family doctor, and they can give you a prescription for a few days of prednisone, and this can be very effective to, again, decrease the inflammation from the steroid flare. The reason you get a steroid flare is because cortisone has little crystals in it, and these crystals just cause soft tissue irritation around the area, and that's what's responsible for your steroid flare. Apart from that, again, 1 in 20 people, about 5% of people can get some facial flushing, and that's when your face goes a bit red, and that can last for 24 or 48 hours. If you're female, you can find that your next period's a bit heavier than normal, and you can get some breakthrough bleeding from having a cortisone injection. So the reasons we'll use cortisone, so I'll do around 4 to 5 cortisone injections a day, and the majority of the injections are to shoulders or to knees. And the main reason, especially in shoulders, is if you've got a bursa, you've got subacromial impingement, and it's just to get rid of the inflammation around that bursa, get rid of the pain, so that you can work on your rotator cuff strengthening exercises, building up your rotator cuff strength and hopefully getting back to normal. The cortisone should stay working for around 6 to 8 weeks, and in that time, if you can build up the strength, by the time the cortisone wears off, hopefully things are getting back to normal. The other common injection I'll do is to knees, and that tends to be for something like arthritis. Arthritis is where you have a wear of the cartilage surface, and it's more likely your knee or your joint's more likely to become inflamed and irritated with that, and the cortisone can be very useful to break that cycle of inflammation, get rid of that inflammation and get things back to where they were before. It doesn't stop it flaring up again in the future. It just means that you get over that episode, get back to normal, and again are able to build up the strength and hopefully settle things down as best as possible. So there's a few common misconceptions about cortisone injections. So the one thing that people will always say to me is, how many injections can you have? Generally speaking, we don't like doing more than 3 cortisone injections into any one area per year. And the reason is, if you do more than 3 cortisone injections, you're not really treating the underlying problem, you're just masking it, and you need to think about another way of approaching this and doing something else. Other things, people worry that cortisone injections are very painful, and that depends where you're injecting. I generally find that if you're injecting little joints in the finger, then that is painful because it's a very small joint and there's not a lot of room there for cortisone to be injected, and that's what tends to be painful. Whereas if you're injecting someone's shoulder, it's a really big joint, there's a lot of space in there, and it doesn't tend to hurt too much. I normally tell my patients that it hurts similar, if not less, than having a blood test, and the injection shouldn't be that painful. The other thing that people ask me about is it's not natural and is it going to do damage and all those sorts of things. So it's important to realise that the body does produce cortisol every day, so it's the body's natural anti-inflammatory, and it's quite often why you can be more painful at night. When the body's natural anti-inflammatory goes low, your cortisol level goes low, and then as you wake up in the morning and get moving, your cortisol level comes up and everything warms up and you start to feel better. We don't like doing too many injections because, in theory, they can cause some damage. And there's been some good research about this, looking at arthritis in joints. And we know that if you inject lots of cortisone, or you repeatedly inject cortisone, then it can cause some damage to that cartilage. What we also know, though, is if you've got a sore and inflamed joint, then the inflammatory fluid that you have from it being sore and inflamed will be causing some damage as well. So as long as you're injecting the cortisone for the right reason, because someone's got an inflamed, angry, sore joint, then I think you're negating the damage that you'd be doing anyway from the inflammatory fluid there, and I'm not that worried about it. But it is something where you don't want to be doing multiple injections without an inflamed joint, because then we know you will be doing some damage. We also know that it can soften tissue, so if you're doing multiple injections into shoulders, around the rotator cuff and those sorts of things, we know that it can soften the tissue there, and it isn't a good thing to do. But again, as long as you're just doing 1-2 injections, I'm not that worried about it, and it shouldn't be too much of an issue. So in summary, cortisone is a very common injection to have. It's a very strong anti-inflammatory. It's injected to bring down that inflammation, let the body heal the area that's been inflamed, and also let you build up your strength. And that's the critical thing. Just having the injection and not doing anything else, more than likely it will flare up again. If you do the injection and use that time to work away on strengthening exercises, build up your strength, then you're much likely to get a good outcome. There are obviously side effects with any injection, but they are fairly minor, and you don't want to do too many injections again, because you're not treating the problem and you need to think about something else. I hope that answers all your questions about cortisone injections, and if you have any further questions, please leave them in the comments below. Thanks.